Hello, hello, hello. I know I'm just a little bit late. Hello. Welcome, welcome. Come on in. Come on in. Hello, Miss Linda. Hello, Miss Latoya Renee. Yes, Amazing Grace 1202. God bless Thursday. Yes, yes, yes. Hey, Miko, baby. How am I doing? I'm doing great. How are you doing? Hello, welcome everybody. Share the video and let people know that I'm on. Your girl is on, and I'm going to answer a few questions. The topic that I need to talk about is not a long topic, but it's something that comes up in my practice, and I think there's a little bit of confusion about the massages that you need after plastic surgery, specifically liposuction. It's late, y'all. I'm sorry I'm yawning. I'm not sleepy, but I'm yawning. And now probably some of y'all are yawning because y'all watched me yawn, and yawning is contagious. Yes. Chicago Massage Eunice. You know about massaging. All right. So I am Dr. Myla Bennett, board-certified plastic surgeon, practicing in Johns Creek, Georgia. Oh, I can't wait to meet you, Marae 4, on Tuesday. And today I'm just going to do a brief chat about massages after liposuction. So I know people were probably confused by even me saying the two types of massages you need after liposuction, because you only really hear about one type, and that's the lymphatic drainage massage, which is very important. It's a very important part of your post-operative routine to get the best outcome from liposuction, from tummy tucks, from all the different things. Lymphatic massages, lymphatic draining massages are very key and integral to getting the absolute best outcome after surgery. So the reason why lymphatic drainage massages are so important is because after you get any type of surgery, whether it's plastic surgery or any surgery, swelling ensues, right? Everybody knows that areas that get injured or areas that get surgery get swelling also. So what happens when you're trying to heal something, your body has to bring the cells into that area that heal. The cells that clean up the mess, the cells that lay down new collagen and remodel things in order to get everything cleaned up and in working order again. And the way that those cells get there is by way of fluid. They travel to the area by way of fluid. It's like a lazy river. You know how in the lazy river, people are floating around on the water. The water is carrying people and they're just kind of floating. And then when they're ready to get out, they'll stand up and walk over to the exit of the lazy river to get out, right? Well, the cells are floating along in the fluid. And when it's time, when they get to the area where the injury is or where the surgery was, they get off and go over to the surgery and just like to the surgical site and start cleaning up stuff. And just like when people get out of the lazy river and to walk off, they splash water and drop water behind wherever they walk when they come out of that, right? The water that's splashed off of those cells behind is what we see as fluid. And that gets left there. And so lymphatic drainage massages, they help to push that fluid back into your lymphatic system, which is a system that runs alongside your blood vessels. And then it gets dumped back into your bloodstream from the lymphatic channels. But that gets it out of your tissues. So it gets removed from your tissues into your lymphatic system, and then that gets put back into your bloodstream. So that's how the swelling gets cleaned up quicker. The lymphatic drainage massages help guide things to the lymphatic, the lymph nodes and the channels, the lymphatic channels, the little highways that carry this fluid that drops it back off into the bloodstream. So lymphatic drain, how do you know?
It said both your ball players have been selected to put on a 5-star team.
Oh, they responded back already?
Mm-hmm.
Oh, good. Congratulations, baby boy.
I just started crying.
Did you really? I'm sorry, y'all. My son just found out he just made the travel baseball team. He just found out. He wrote a sign. He opened my door and put the sign up like, I made the travel team. Sorry about that. So anyway, the fluid, we guide it through massage, gentle massage. So lymphatic drainage massaging is gentle. It doesn't require a lot of pressure and force. It literally is there to encourage and open up the lymphatic channels. Thanks, everybody. Open up the lymphatic channels and let the fluid enter back into there, and then it dumps it into your bloodstream, and then you pee it out, okay? And so anybody who's had a lymphatic massage, you can attest to this. After your massage, you have to go pee. Like the ladies, a lot of times after their massages, when they leave the office, they might go and pee twice before they leave the office after the massage. Like literally, it just dumps a bunch of fluid back into your bloodstream, and your kidneys get to dispose of the excess, right? So the lymphatic drainage massages help with swelling. That's what they're there to help with. They're help to put that fluid back into the lazy river. Lazy river, okay? They're there. The lymphatic drainage massage helps reduce the swelling faster. The faster your swelling goes down, the sooner your skin shrinks. If you're sitting there holding swelling, then your skin stays stretched out, and then that's working against what we're trying to do. Okay? So that's the first kind of massage. The second kind of massage has nothing to do with swelling. That deals with scar tissue. So lymphatic drainage massages are not going to do much for scar tissue because it's just light. It's light pressure. You don't need a lot of pressure to get the lymphatic channels opened up and for that fluid to be put back into the lymphatic channels. It doesn't take a lot of pressure at all. That's a light touch process. But if you're dealing with firm areas, so anyone who's had liposuction before will tell you, not everybody, but a fair amount of people, they'll get areas where it's extra firm. People who have had, okay, if I do a lot of lipo in one particular region, like if it's really thick in one, so one example is like the lower abdomen. Usually that is much thicker than the upper abdomen in most people, not everybody. And so I may do a lot of liposuction just in the lower abdomen. I might take a liter out of just the lower abdomen, right? Anytime there's an area where I do a lot of liposuction, it's going to create more injury. It's going to create more scar tissue. That light touch of a lymphatic drainage massage is not going to make scar tissue reduce. So in order to shrink scar tissue, you need pressure. So that is going to be a different type of massage because this one's going to actually put pressure. Now, in my patients, I don't have them use firm pressure everywhere, just in the areas where it's firm, where it's more scar tissue or things are more dense. People who deal with fibrosis or fibrotic areas, you're going to need a more pressure on the massage and regularly in order to help break up some of that scar tissue. If you're dealing with fibrosis, the massaging might not even be enough. But if it's just firmness and your body's making extra scar, or you're somebody who makes extra scar, massaging with pressure is going to be a game changer. Now, when I had my daughter, my boys were both vaginal births, but my daughter was a C-section. And I actually made one of the worst C-section scars I've ever seen. My C-section scar was literally this thick. It was probably maybe 3 or 4 weeks after she was born when I realized that my scar just got so thick. It itched so bad. It was so sore. And that sucker was literally as thick as my pinky. And while I was sitting up at home with this newborn preemie, I knew that how powerful massage was for scar tissue, for keloids, for hypertrophic scars. I know that because I'm a plastic surgeon. And when I tell my patients, when they're like, oh, this scar feels thick, I'm like, you got to massage it. You got to put pressure on it and roll it between your fingers. They don't believe that that's where they're like, want. They want you to give them a shot. They want you to give them a cream. They want you to give them something. But really the most powerful thing you can do is massage it. And that's all I did to my C-section scar. It was thick. It was dark. It was literally as thick as my pinky. Right? And I would literally just take it. Ooh, Sorry, I forgot I was using that to prop up my stand. Hold on. Let's see. I would take the scar between my fingers. I would literally pinch it up between my fingers and just be rolling it with firm pressure. It would hurt. Like I would be like wincing, like, but it's not actually hurting it. It just hurt. It's sore, but it didn't. It wasn't hurting me. It was helping break up that scar tissue. And so, after a couple weeks of me doing that, it didn't hurt me to do it anymore. It still felt thick. It seemed like it wasn't doing anything. But then all of a sudden, like maybe 2 or 3 months later, I noticed, I'm like, wait a minute, this thing is down. And I ultimately got it completely flat. And in some spots, I can't see where the scar was. Like, it looks like a discontinuous scar because, like, it's like a little bit, it's like a little line. It's dark, it's slightly darker than the other skin around it. But then there's a big space between it where it looks like my normal skin. It doesn't even look like a scar. But when I tell you that I went crazy on that scar, I put so much, it would hurt. At first, it hurt. So most people won't do it because it's tender. But it eventually stops hurting. It's like it dulls out the nerve endings in there when you keep doing it. I kept doing it until that thing flattened out. So I always teach my patients about that when they have areas that are thick. If you have a scar that's thick, or if you just have scar tissue underneath your liposuction, I'll tell them when it's on their belly, it's hard. If it's a thick area that's like that, like at the bottom of your belly, you can't roll it between your fingers so much. So I'll tell them to take their knuckles, literally, and I'll be like, knuckle it. Put your knuckles into the area, and put pressure, and it'll break up the scar tissue. So the 2 types of massages, one is for swelling, one is for scar. The lymphatic drainage massage is not going to be an adequate type of massage to break up scar tissue. And all that pressure that's used to break up scar tissue is absolutely unnecessary for lymphatic drainage massages. It's making people uncomfortable unnecessarily. If everything is soft and you're just swollen, you don't need to apply all that pressure. There's no point. Okay? So that's the 2 types of massages. You have your your massage to reduce swelling, the lymphatic drainage massage, and then a deeper, I'm not going to call it a deep tissue massage, but a massage with more pressure used in order to break up scar tissue. And those are the 2 types of massages that a person may need after plastic surgery, after any surgery, actually. Do you all have any questions about that? You all are awful quiet tonight. I'm just trying to give a moment to see if anyone has any questions they want to ask before I sign off. I told y'all this one will be short and sweet, but important no less. You're welcome. Thank you for sharing this. There are a lot of providers that perform exactly what you were talking about and get pushback. About the second type, if there's scar tissue. Because some people, some people, when you speak of providers, I'm assuming you're talking about people who do the massages. And some people, they're taught one thing and then everything, and so they got a hammer and everything is a nail. And the key is understanding what you're treating, right? So if we're just trying to get lymphatic drainage to get swelling reduced, then that's what we need this one. If a person's got a bunch of firm, hard areas and there's scar tissue involved, then you're going to need pressure. Yes. You don't want to be putting a bunch of pressure on a fresh incision, but on a fresh incision, you don't know if you have scar tissue yet, right? So if you're in the area of liposuction, that's not really an issue. The incisions are tiny and they're definitely healed over in no time, like a few days. But if you're talking about a tummy tuck or something like that, I don't want people doing the deep, the firm pressure massages on my tummy tuck incision before it has turned to a scar. Like when it's still an incision, it could easily be broken open, split open with firm pressure. So I don't want people doing that type of massage, the second kind. I don't want people doing that second kind of massage on my tummy tuck patients until their incision has transitioned over to being an actual scar. It's also a battle between post-op therapists and edema therapists. I'm trained in post-op for cosmetic and oncology. I'm a certified lymph. I understand both worlds. Right. Like, I'm not sure what the battles are. That's an interesting topic. I guess I don't hear about all those types of things since I don't deal in oncology and stuff like that. But not anymore anyway, I don't. But the principles are similar. And sometimes people just want to argue. I don't touch tummy tuck incisions before 3 weeks and it has to have transition or we wait. Exactly. Yeah, nothing like that happens before 3 weeks. Because usually that's around between 2 and 4 weeks is when people's incision will transition over to a scar. And once that has happened, then that's when, we can do firm pressure things if necessary. But for liposuction, it's safe to do it as soon as you recognize that there's scar tissue. Because just like you said, the battle between post-op therapists and edema therapists, like, what's the difference? Post-op, you have edema. Edema is swelling. That's what we're trying to resolve. Like, what's the difference between a post-op therapist and an edema therapist? Surgeons will say no massage or tummy tuck next day, and it's like how I understand why they say don't massage your tummy tucks the next day. I don't, because it's just, unless I'm doing it, I don't want people messing with my tummy tuck people the next day. You can't really mess nothing up with liposuction doing a massage the next day, so it's good. But tummy tucks, like, you just don't want anybody messing around I don't want nobody messing around my incision right after my tummy tuck. I'm like, even in my office, we don't even give tummy tucks lymphatic massages right after. We don't do it the next day. It's usually at least a week. Unless it was like, if I do a tummy tuck in the front and do lipo in the back, I might have them sit up and get a back massage. But no one touches the front of my tummy tucks right after surgery. No. Post-op includes edema, but isn't a specific modality by the massage board. Okay, I get it. That makes sense. Yeah, I don't tell them to get a lymphatic massage the next day with a tummy tuck. But like you said, each surgeon is different. I just I just don't like. If somebody does too much, like that, they're back in the OR. You know what I'm saying? It's just not worth it to me. Once the swelling's not gonna hurt them, and so usually I wait at least a week before I let anybody do anything to my tummy tuck. The issue is that post-op is so underregulated. Anyone can call themselves a provider, and it's an issue. I mean, this probably is not. I will teach my patients' spouses how to do the lymphatic massages for their liposuction. It's just like for liposuction, it's not rocket science. Like we show them the techniques and they just mimic what we tell them to do, and then they'll come into us weekly for a massage, but their spouse will be massaging them daily at home. It's for in that area, we'll show people what to do. What about if you had a butt lift and liposuction on your front midsection? What would you tell the patient? What if you had a butt lift? Like a Brazilian butt lift or the excisional kind of butt lift? What do you feel about drains? I guess I should say how long before you remove them. So for liposuction, I don't put drains in. For liposuction, I leave the holes open and all the fluid comes out in 24 hours. When I put the compression garment on, it squeezes their body like a sponge and all that fluid, that tumescent solution, comes out of those holes. For tummy tucks, they're in for 7 to 10 days. Yeah. For tummy tucks, they're in for 7 to 10 days. And I have not had a seroma from a liposuction patient. Yeah, for tummy tuck. I have not had one of my lipo patients have a seroma in 7 years. I literally have not had one. So if they have an incisional lift, I wouldn't do the lymphatic massages on the back side out the gate. I would not. They would be able to, and the liposuction in the front, then I would let them get the lymphatic massage in the front. I know clients that have drains removed before 7 days are more likely to get a seroma. Exactly. It usually is never before 7 days. Every so often somebody will, but my rule of thumb is not the amount of days. I go by the amount of output in the drain. So the drain has to be putting out less than 20 cc's in a 24-hour period before I'm willing to pull it. Yeah, it just depends on the amount of drainage the person is making. If it's 7 days out and it's 40 cc's every 24 hours, I'm not pulling it. It stays. And then if the drain is in there for a long time and it finally comes down, I do 20 cc's in 24 hours, under 20. And if they say it's been in for 3 weeks and then it finally tapers off, I'm going to make it be under 20 for 2 days. She said, oh, okay, I learned 25 cc's. It's honestly, when I was in training, I learned 30 cc's. But then in my practice, I do 20. Because in my training, every so often, somebody will get a seroma. When I tell you I rarely get seromas, I mean, literally, I've had none from liposuction in over 7 years. I've had maybe 2 from tummy tucks in 7 years. I never get them, but I'm super conservative. Like, what can you put on to get the scars blending better? Massaging it. Massaging it and silicone scar strips helps with that. Or compound creams with different brighteners in it, like hydroquinone or kojic acid or stuff like that. So, any more questions? Thanks for the discussion, Sugarstone Spa. Okay, I'm happy I did my wet lipo with Doc. I look amazing. I don't know how to act out here. Thanks, Doc. You're welcome, boo. Love the no-name brand silicone strips on Amazon that come in white box with orange writing. Yeah, a lot of my people get those. They work great and you can easily tear it to size as needed. Yeah. We're coming up on the end of we're coming up on the end of July. So my summer consultation special I'm going to make that come to an end officially at the end of this month. So, basically what's been happening is when people get their consults, if they book their surgeries, we only actually have 2 more dates left for August. Because July and August suck. People are like, really June, the end of June, July is, people are not trying to get surgery. They're out vacation and they're, doing all kind of summertime stuff. So I have been incentivizing people to get surgery in the summertime. Well, I only have 2 more dates left in August. So whoever gets those dates, that's the end of the little summertime specials I've been giving. But if you want to reach out for a consultation for liposuction or come and let me take care of your skin or something like that, you can reach out by calling. I know nobody wants to wear that garment during the summer, but you can save yourself maybe a few $1,000s depending on what you're getting if you do. So, I mean, you don't have to, but my office number is 678-325-0006, or you can click the link in my bio and submit a consultation request, and someone will call you in the morning. Tomorrow is Friday, July 21st, and my office is open from 9 a.m. until 1 p.m. Eastern Standard Time. We close early on Fridays. So give us a call tomorrow if you want to try to hurry up and get in on this these summer deals that we've been having. I've met some wonderful people this summer. They all came from here. And yeah, it's been an interesting summer. It's been really interesting. I've met some amazing people inside of my practice and outside of my practice. But the summer fun stuff is coming to a close. These kids are going to be back in school in a few weeks. Football season has started for me. The only reason I thought I was going to be able to get on here early because we got rained out of my oldest son's football practice. So we got to get home a little bit earlier. But then, when you start off early and then you end up late, that's kind of what happened once I got home. I didn't know what to do with myself having part of my evening free. So anyway, go ahead and reach out to my website or call my office in the morning. And yeah, I might go live again tonight talking about stuff that has nothing to do with surgery, because it's been a lot of developments. I don't know if y'all heard about Oprah, your girl. Folks are spilling some really bad news about her. It's not good, y'all. You're an amazing person. I thank you for all that you do and drop in knowledge. Oh, thank you. Thank you so much. So it's a few things going on that I might want to call y'all and talk about. Y'all know how I like to. It'll probably be something that don't get saved. Just FYI. I ain't gonna put it on here because then I don't want Instagram to take down this video, because we just talk about massage and it was a nice little massage video. And I don't want to ruin it with this, but this was Dr. Mila coming at y'all with this one. Mila is going to call y'all in a little while after I get my shower and stuff. Mila might call y'all back and talk about stuff that I probably won't be able to leave up. All right. So if you want to hear about it, stay tuned. Give me about 30 minutes to get my shower and stuff and get tucked in. And I'll share what I found, y'all. Well, I ain't find it. It bust me in the face, but your girl is tripping out here. If you want to get a heads up to the discussion, Google scandal for Oprah's school for girls in Africa. Start there. Google that. Apparently, there's been several scandals. I missed all of it, but go and Google that, and then I'll call y'all in about 30 minutes after I get ready for bed. All right? Okay, I'll check y'all later. Bye.